Thank you everyone for attending. Great, the recording started. So, hi everyone, my name is Christina. I'm a public health registrar, and welcome to the Bolder Healthier Plus Champions Cost of Living webinar. This webinar will be recorded, as Ben said, for those who can't attend, and also for future use and reference. There will be 4 webinars in this cost of living series. In addition to this one, there'll be youth, workplace, and communities across this week and next. So today's is the Plus Champions webinar. The information in this webinar is intended for use by the Plus Champion strand. However, a lot of the information regarding rising cost of living is transferable to the other strands of Bolder Healthier Champions. So what is the cost of living crisis? It's definitely a term that we've had more and more throughout the last year, and definitely more in the last couple of months. It's a term which refers to an ongoing situation in the UK from 2021 onwards. It is a term which can cause anxiety, worry, and uncertainty. It refers to the cost of everyday essentials like energy and food rising faster than average incomes. There is a growing gap between what people have and what people actually need for a decent standard of living. Rising costs present the most significant challenge to living standards for many years, especially after the social and economic uncertainty following the COVID pandemic. So we know that the rising cost of living is affecting and will continue to impact everyone. In July 2022, 91% of UK households reported that their cost of living had increased in the previous month. This was up from 62% in November of 2021. Those surveyed mainly attributed this to higher food, electricity, and fuel costs. Fortunately, this crisis will impact the poorest UK households, those already spending a significant proportion of household income on food and housing costs. And looking at financial forecasts, they predict that real household disposable income in the UK will continue to fall in 2022 and 2023. And this actually reflects the biggest fall in living standards since the mid-1950s. So what's going up? It seems like everything is going up at the moment. And this slide presents some of those costs. However, it's not an exhaustive list, and there will be certain lifestyle household essential goods that are rising that aren't listed here. So some of the key costs that are rising, travel, average travel costs have increased by 45%. Rent and mortgages continue to go up. So social housing rent has increased by 4.1%. Private rental prices increased by 3%, and mortgage interest rates have increased by 0.5%. And all of these percentage increase rises reflect the change from 2021 to 2022, unless stated otherwise on this slide. We know that water bills and energy bills have increased, so water by 1.4% and energy household bills by 54% in April, and a further rise of 27% in October. Childcare costs are rising, so these are annual costs, include nursery places, after school clubs and things like that, and that's 16% change between 2018 and 2022. Personal goods and services for a single working adult per week have increased by 49%. So that encompasses everything from food, drink, household essentials, and a lot of miscellaneous but essential items for families. So we know that our communities are taking action because of these rising costs. So this information on this slide comes from the Census 2021 relating to the West Midlands population. So 89% of people reported their cost of living increasing over the previous month. So 6 in 10 people are spending less on non-essentials. 5 in 10 people are using less gas and electricity. 5 in 10 people are cutting down on non-essential journeys in their vehicle. 4 in 10 people are spending less on food shopping and essentials, and worryingly, 1 in 10 people are using more credit, exposing themselves to more potential debt than usual. So the risks of rising cost of living to our communities are far-reaching. We're sure to see them in the short and the long term. So again, some of these risks listed on this slide may be more or less relevant to the people that you work with, interact with, observe, but it's not an exhaustive list. So working through them, we have fuel poverty. So cold and damp living conditions increase the risk of respiratory and cardiovascular illness and can also worsen existing long-term conditions. This can lead to people making choices around turning down heating, can also lead to cold-related deaths and general poor health. The social and mental health impacts of the rising cost of living shouldn't be overlooked. So shame over requiring financial or food assistance, as well as financial pressures, can lead to worsening mental health, stress, worry, anxiety. Rising costs for everyday social activities increase the risk of loneliness and social isolation, as people may choose to not pay for travel, participation in activities. Debt is also a very important short and long-term consequence of rising cost of living. So this may have the greatest impact for those people already on low or unstable incomes or relying on benefits. Those people not meeting rent or mortgage repayment obligations will, as a result, have increased financial pressures, which then may lead to difficult decisions over eating versus heating. Speaking of food as well, high price rises in food and energy mean people may think twice about what they are buying. So again, tough decisions sometimes mean people may be tempted to skip meals with less money available to spend on healthy food. So this can lead to not being able to afford sufficient food and also malnourishment. Air quality may be something that affects local communities, so more people may be relying on solid fuel burners due to the cost of electricity and gas, which could exacerbate respiratory and cardiovascular conditions. And the final one on that slide is housing. So we have spoken already about the rising social private rent costs as well as mortgages. These rising costs may lead to forced evictions and debt, and there's a risk that many people sleep rough for the first time as households struggle to make ends meet. A lot of these households which are struggling to make ends meet may be experiencing this for the first time and may otherwise have not experienced debt or financial insecurity before this crisis, and so might find it more difficult to talk about their issues because of shame, anxiety, and worry over it. So, as Ben has mentioned, it is a shifting landscape, and impacts of the rising cost of living will be seen for months and even years to come. The national and local response as a result is also changing, and we recommend staying abreast with the local response by regularly checking the council's websites for updates on a range of support being offered for residents over the coming months. Great, so we've talked about the varying impacts of rising cost of living on our communities, which will be seen in the short and the long term. And you'll be seeing those in varying different scenarios, again, with the people that you work, live and serve. So which impacts may be most impacted by rising costs? It may have the most likely have the most impact on those poorest households, those already spending a large proportion of their income on housing and food. Those are the ones that are most vulnerable and will be impacted the hardest. So this information on this slide is from the Office for National Statistics 2019 Deprivation Index. 22.2% of the population in Birmingham was income deprived in 2019. 28% of children currently live in income deprived households, and 26% of over 60s are income deprived. So income deprivation is experienced across the life course in Birmingham. This table here highlights those areas in Birmingham which are amongst the top 1% of deprived neighbourhoods nationally. We know that deprivation is concentrated in a ring around the city centre, but there is also significant deprivation across the city, particularly to the east of the city centre and also in the outer city to the south, west and northeast. So this slide highlights some of the Birmingham City Council risk mapping that has happened, and again will continue to evolve as the situation changes. So the leader and the cabinet have announced a cost of living emergency and have convened the city partnership to address the crisis. Other public bodies and voluntary sector organisations quickly developing their response to the crisis as well. A strategic response group will be established with membership from the chief officers of the council, plus a small number of key external partners. So there's been some initial mapping of short-term priorities that require immediate focus and additional activity. And these are improving the availability of advice to residents with a focus on increasing benefit take-up, increasing energy efficiency with a focus on reducing costs, increasing the supply of food through food banks across the city, and ensuring the provision of a network of warm spaces across the city, starting with libraries. So what is the role of Bolder Healthier Champions? So we would like key messages and a call to action for Bolder Healthier Champions to follow these three sections. So talking about the impact that the rising cost of living is having on people in your community, connecting people to support through web pages and services, and feedback to us where more help is needed so we can continue to improve the support for citizens. So starting with the first step, talking. Talking about the impact that rising cost of living is having on people in your communities helps reduce shame and stigma and helps raise awareness, especially for those who have never had to worry about paying their rent or paying their mortgage prior to the crisis and are now currently ashamed, deeply worried, and not sure what steps to take next. So what we would present is a talking strategy that is grounded in MEC theory. So MEC, making every contact count, is an approach to improving health and reducing health inequalities developed by the NHS and local government. Many of you will be aware of this already. So we would advise that you access the free, if you have not already, access free e-learning for healthcare training on MEC to support you improving your skills. So whilst MEC may have traditionally looked at health interactions, we're looking at these brief interventions going beyond health into everyday situations like discussing cost of living crises and things like that. So how can you provide brief support in everyday interactions? So we would advise using the simple ask, assist and act model, and this builds on the MEC theory, but as I've said, is expanding to non-health topics. So brief interventions can take seconds. It's not a detailed conversation, it's about opening the door, showing people where to go once you've had that conversation and connecting people to experts. So for example, for budgeting, you might like to start with an open question such as, do you have any worries relating to money, budgeting, borrowing or debt? And then you might take the time to find out if they would like any extra assistance. Would they like any extra assistance in budgeting? Do they know the benefits of it? And if they respond positively to that, then you can use the resources that are available in the next slides, which we will share to then signpost them and provide them with help and access to support and services. So in this example, the Money Helper service, which has web chat and WhatsApp available. So another example is for debt and borrowing. So again, using that very simple ask, assist, act model. With ask, you're asking open questions. Do you have any worries relating to money, budgeting, borrowing or debt? So similar to previous. And then asking if they would like any further information on the many different free and recommended debt advice services. If they respond that they would indeed like that help, then you can then refer them to national debt support agencies such as National Debt Line, Step Change, and again, use the slides that are coming up for a range of signposting advice. The final example we've given here is for non-urgent mental health support. So primarily, if someone is at immediate risk of harming themselves or others, you should tell them to go to their GP. Again, using the Ask, Assist and Act model, asking how are you feeling at the moment, what's been happening to you recently. And again, finding out a bit more through assist. So you mentioned you're feeling low. Why do you think this is? Would you like some more information on services that may help you? And finally, you can do act, which is encourage the person to contact their GP if they're experiencing any immediate risk of harming themselves, or refer them to national resources such as Mind, NHS, or the Birmingham City Council wellbeing resources, which can also provide you with support. Great, so we've gone through talk. The next step is connect. So once you've spoken to somebody and they're open to being referred and signposted, then you can connect them to those support. The next slides provide a lot of different links that you can use. So firstly, you can connect to crisis support, and that's Birmingham City Council's local welfare provision scheme, which helps vulnerable people in a short-term crisis. If you're experiencing immediate problems, you can use that number there. And then there are further local sources of help. Apologies, I've just got a bit of a cough right now. And then you can connect to council support as well. So Birmingham City Council's contact centre is open 9 AM to 5 PM, Monday to Friday. and supports on a range of topics. So this is really useful when you speak to somebody and actually they need help in a variety of things. So that could be emergency food, benefits inquiries, council tax inquiries, accommodation and homelessness. And there's a number there that you can use, and also the address is there for 2 walk-in advice centres. So you can check the website there for more information about opening times and support. After thinking about that short-term crisis support, you can also use these resources for support around bills. So there's many there. There's national schemes that can be used, and actually it's about making sure people know what they're entitled to. So if they're an older person who doesn't know about the pensioner cost of living payment, or somebody that's entitled to the cold weather payment but not sure, you can advise them about this. There's also local schemes in Birmingham to help with energy bills, and you can find these on the Birmingham Council website. And then also thinking about phone bills, water bills, and using those links there. So you can also connect people to income and debt support, again, by referring them to government information such as the Money Helper Service, but also to national debt agencies, which can provide impartial, free support for debt advice. So that can be National Debt Line, Step Change, Pay Plan, Debt Advice Foundation. And this is sort of a miscellaneous page, but you might find helpful. So things like mental health and wellbeing support, Birmingham City Council wellbeing resources. It's a great page with access, which provides information about how to access mental health services. Do people know that they might be entitled to money off their travel if they travel by train? Do families with young children who may be pregnant and may be entitled to Healthy Start vouchers? And then again, making sure people are aware of entitlement for NHS free prescriptions if they are entitled to them. So ending on a case study, and again, this isn't a sort of prescriptive case study, you'll be encountering lots of different situations, but just one to sort of get you thinking. So John is a local community pharmacist and also a Bolder Healthier champion. He's chatting to a regular patient, Mary, whilst dispensing medications for her chronic disc condition. He explains that the medications need to be stored in a fridge. So Mary explains that that might be a problem because she's been turning off her fridge and she doesn't need it to save on energy costs. She's recently lost her job, so that's one measure that she's been taking. So John's able to offer some sympathy around having lost the job, especially at this time, and then ask her whether she would like to be signposted to some resources around benefits support and entitlement, which she may not know about. And this may include the government energy bill support like the cold weather payment. So as a result of that conversation, John was firstly able to signpost Mary to Birmingham City Council resources on benefit entitlements and support with energy costs. But also importantly, talking openly about the impact of rising costs on everybody helps to raise awareness and reduce stigma. So particularly for those people who have not suffered from financial insecurity prior to this time, might find it really especially difficult to talk about it. So in this case, Mary was not aware of what she was entitled to. So additionally, John was able to provide her advice around eligibility for free NHS prescriptions, as she was going to be on this medication for a long period of time. So the final step in our call to action is feedback to us where more help is needed, so we can continue to improve the support for citizens. That email address there is one for you to use and do exactly that. Feedback to us where you feel that more help is needed. So just to run through that call to action again, those key messages that you can use just to shape the conversation. So first of all, it's about talking to people about the impact that the rising cost of living has on them. Secondly, if they are willing and accepting of help, connecting them to support through the support pages and services. And then finally, feedback to us where more help is needed so we can continue to improve the support for citizens. And that concludes the presentation.